How you doing today?
Doing pretty good, not too bad.
Doing pretty good. Yeah. Cool. Well, my name's Tucker Gamble. I'm a student physical therapist working under Dr. Clausen. He had me come in today because we're going to be doing something called ultrasound on your ankle. I know you came in, you just injured your ankle. So we're going to go ahead and do ultrasound, and we'll get started on that in just a second. So with Michael, we have an acute ankle sprain. So his ankle sprain happened a few days ago, so he's in the inflammatory response of healing because it's within the first few days, which means that we're probably also in the max protection stage of the tissues as well. The indications for him is he has swelling, some pain, which means that we would use non-thermal ultrasound because the contraindication would be thermal ultrasound for this specific situation. Other contraindications would be if he has a pacemaker, if he has thrombophlebitis, I think is how it's pronounced. If he has any total joint replacement down in his ankle, if he has any decreased sensation for temperature, decreased sensation for touch, if he had any open wounds, so I'd check his ankle, make sure that he doesn't have any open wounds on it, and that would be good. So I would ask him that, and I'll ask him that later as well. And then I would tell Michael. So Michael, the reason we're going to be doing this ultrasound is what it does is it basically sends sound waves down into your tissues. So like kind of reverberate the tissues, and what it does is it does something called microstreaming and cavitation. Basically what that means is it's just moving the cells around, and that moving the cells around is going to promote healing. It's going to help your ankle heal a little bit better. So help decrease inflammation, increase the blood flow to the area so we can get the good stuff in, the bad stuff out, and as well it'll help us in pain control as well. So we should be getting all those benefits. And again, we're going to be using something called non-thermal ultrasound, which that means is it will not heat your tissues, because if we heat the tissues, it's going to do the opposite of basically what I said. It'll help inflammation, and we want to decrease inflammation at this point.
That'll be nice.
So when we're doing this, you should not feel any heating involved. So if you ever feel anything that feels like it's heating, let me know, and we'll stop the treatment, and we'll work on from there. Does that sound good?
Yeah.
Yeah. Okay. So then when we come over here, so we position Michael. I'm gonna ask him, Michael, do you feel comfortable where you're at? You can lay totally down if you want.
Yeah, I'll probably lay down. Yeah, I'm fine here.
Go ahead and lay down. I'll position him with his ankle off the edge of the table. Just maybe, Michael, can we scoot down a little bit actually?
Towards
you
the
okay
feet.
with that? Yeah, towards your feet. Perfect. That feel all right?
Yeah, that's good.
Okay. I just position him down here just so that we don't get anything on the table, sitting off the end of the table, because we don't have a high-low table here and we don't have the stools. It would be bad mechanics for me, and I have to go through the whole day, and that would not be good for my back. And as well, I mean, I don't want him rolling onto the side because that's an awkward position to internally rotate the hips so we can see it. So this was just the best position that we could find here. So now that he's stationed up well, I would now check and say, hey, Michael, in order to do this treatment, I'm going to have to place my hands on your ankle. And then as well, we're going to be putting a little bit of gel and this ultrasound head right here on your ankle as well. So is that all right if I touch your ankle and place it on you?
Yeah, that's good.
Okay. Okay, so I would check his skin. I'd make sure that in the area that I'm going to be treating, there is no open wounds or anything. So the skin looks great. I would then also ask him, Michael, do you have any pacemakers?
I do not.
Have you ever had your ankle joint replaced?
Nope.
You don't have any metal down in your ankle?
Nope.
No. I'd ask him, do you ever have any history of thrombophlebitis or thrombosis?
Nope.
No. You're not pregnant?
I'm not.
I would ask him, do you have any decreased sensation? If I touch your ankle, can you feel that okay?
Yeah, I can feel that.
And my hands feel pretty cold right now. Can you feel that my hands are cold too?
They do feel cold.
Okay, so then I know that he's able to sense both temperature and touch, so there's no decreased sensation. So with that, I'd know that he's good to go and that we can continue on with treatment. So we come over here to the machine. We turn the machine on. We're going to wait for it to boot up. We hit ultrasound. Because it's on the ankle and it's a superficial, we're going to go 3 megahertz because that targets the superficial tissues more. We don't want thermal, so we're going to turn it down to 20% duty cycle, which means that it's on for 20% of the time, off for 20% of the time. And then when we get to it, I'm going to turn this up to 0.5 just so that the power doesn't burn him while we're going. If I turned it up any higher, we'd be at risk of burning him at our 3 megahertz. So then I'm going to take, so before I turn any of that on, I'm going to slide over a little bit. I'm going to apply a good amount of this medium here, so we're going to have some gel. I'm going to make sure that it, slide that back in there for safety. I just want to make sure that there is enough, and we're just going to want we're going to want to stay within like 2 to 3 times the effective radiating area. Since we don't know exactly what that is for our ultrasound head that we have, we're just going to keep it roughly around the size of that ultrasound. And because it's a lateral ankle sprain and the pain is mostly up through here, we're going to be staying up by that ATFL. With that, I'm going to take the head and just make sure that I get it around. Spread it out. See if there's enough before I get anything started. I'm going to apply just a little bit more onto the head itself. I'm going to go, okay, Michael, so we're going to start the treatment here. So I'm going to place the ultrasound head on his ankle first. I'm going to start it moving in small circles. Then I'm going to come over here for safety, turn it up to 0.5, and then I'm going to hit start. And then we're going to go for about 20 to 30 seconds just to demonstrate. But in reality, we'd go 5 to 10 minutes on this type of treatment. And we just go slow, smooth circles right through that area of the ATFL, keeping it within that 2 to 3 times effective radiating area, ERA. Just going to go here for a little bit. And then while we're doing this, I'd be asking Michael, do you feel any tingling? Do you feel any warmth?
I do not.
Do you feel anything other than the ultrasound head rubbing on your ankle?
No, yeah, that's all I feel. No. Yeah.
You don't feel any other burning sensations, any twitching, any palpitations in your heart? Your heart doesn't feel like it's fluttering or anything?
Nope. No, all I feel is the head moving.
I'd let him know if you ever feel anything abnormal anywhere in your body while we're doing this, just let me know about it, okay? So we've been going for a little bit. I'll make sure to keep the ultrasound head on the skin while I reach over and I turn it off. That just protects the crystal. Then I take it off. I clean off the ultrasound head with some paper towels. So Michael, I'm gonna go ahead and wipe this gel off your leg too.
Okay.
Then I'd ask him as well, Michael, how'd that feel? You didn't really feel anything, right?
Didn't really feel like anything. Okay. Yeah.
That's actually what we want for this type of ultrasound. Like I said earlier, you shouldn't really be feeling anything, but it will help with that tissue healing. Make sure he's nice and clean, and then from this point, we would continue on with our treatment.